Cardiac patients are changing, and the technology we use to treat them needs to change too. Today, a patient receiving a cardiac implant is as likely to be an active 50-year-old expecting to return to a physically demanding lifestyle. BIOTRONIK's closed-loop stimulation technology allows these patients to return to their previous lifestyle with the same cardiac function during physical activity.
Conventional pacemakers monitor how much movement the patient is making with something called an accelerometer. So when the patient moves about, this causes movement in the pacemaker, and this is monitored, and so the pacemaker will boost the heart rate based on that movement. Accelerometers are good, but they obviously won't respond to patients when they're still, and so patients when they're stressed and so on, your heart rate will go up a little bit, or when you're doing a difficult problem, your heart rate does go up. The other thing is some movements don't cause the accelerometer to move, so things like cycling and so on may not cause movement in the accelerometer.
So the closed-loop stimulation system is a reading that's taken from the tip of the lead within the patient's heart itself. It measures certain algorithms within the heart, and it can recognise the changes within the cardiovascular system and therefore change the heart rate itself to meet those changes. From a patient point of view, very, very helpful. If you imagine you have a young patient who's about to sit an exam, if they have a rocker switch, they're sat in the exam room, but they need to have a slightly increased heart rate for a better output to really keep concentrating. The CLS will allow that to happen. It will register that there's a level of stress there and will increase the heart rate to mirror that stress.
BIOTRONIK's closed-loop stimulation technology is the result of years of work to deliver a better experience for patients and allow them to return to an active lifestyle. Our use of intracardiac measurements of heart function to trigger an increase in heart rate results in a much more natural feeling of heart function, an improved standard of care, and more active, healthier patients.